Evening, this is Dr. Ravi. So today's session, Botox fillers and threads, a dentist perspective. Let people join in, and then I'll start with the introduction. And me, myself, and I think everybody should be thankful enough for the speaker who has dedicated and given his Sunday. So let people join in, and maybe in 3 to 5 minutes we'll start the session. This session will last maybe for 30 minutes. So you all can pour in your questions once the guest speaker finishes what common questions we have, and then we can have your questions. If anybody would want to come live, I will have to allow at least one, and drop me a text. So guys, as we all know, there is a lot of unrest among the dentists since quite some time about whether a dentist can do facial aesthetics, Botox fillers, cosmetology, trichology. And upon that, the article from the Tamil Nadu, there is one article that has been circulating that is creating a lot of unrest. Lot many upcoming and budding dentists, they are becoming paranoid that how do we go? So guys, there are many questions. Questions such as what is facial aesthetics, what is cosmetology, what are Botox, fillers, threads, trichology. Who all can do this? And if a dentist can do this, what are their boundaries? What are the limitations? The criteria to select cases for facial aesthetics, and then the legal aspects, definitely. And if at all a budding dentist would want to pursue the facial aesthetics, which are the courses and the criteria to select those courses. So I think there has been so many questions among the mind of so many dentists, and to answer all this, we have this guest speaker today. So guys, to tell you, the speaker we have, he is a very famous into what he does, and you'll know what he does. And to bring clarity on this topic, we've called him, and he promptly said, "Yes, Ravi, I'll be there on your page answering the questions," and he's ready to dedicate his Sunday for all of us. So let me see if I can see his request, or I'll send him a request. So guys, meantime, I'll give you his introduction. So if you visit his Instagram profile, you will see more than a dozen of countries that are being benefited by his services and his mentoring and his presence. Also, by looking at his picture, it's very difficult to come to a conclusion or to say that he's not into modeling. So, guys, he is none other than Dr. Rajat Bhandari. Let me welcome him in the window. And again, I'll repeat. So today, to bring some clarity, we have a guest who is master at doing these things. And as I said, if you visit his Instagram profile, you will see more than 18 to 20 countries that are being benefited by his presence and services. And as I said, by looking at his pictures, it's very difficult to say that he is not into modeling. So guys, welcome Dr. Rajat Bhandari. So let me welcome him.
Hi, good
Hi,
morning.
good evening.
Yes, good evening. Yes. Thank you so much for this wonderful introduction. I don't even deserve 10% of this.
No. I
It's
think
just about having a happy state of mind. That is more important. That's what I feel.
thank you. You
So,
being very honest, and that's what makes you special and stand out among others.
thank you so much. Thank you. So, we made this plan of having this talk in a very short notice. I just saw your message, and We were planning it for probably next week, and then I thought, no, it's better to do it this week. A lot of people have a lot of questions, and there needs to be something spoken about it. And we have to understand, like, where we stand amongst this chaos, and whether our identity being a doctor is being questioned as well. That's but I feel that there is a lot of lack of clarity on the scope of practicing dentistry. Like, to begin with, um, we have to first understand, like, what is the role of a dentist. Like, what is dentistry all about? Is it just about working with teeth? Is it about working in the maxillofacial region? Okay. And I looked up at different definitions of dentistry or stomatology. Some countries call dentistry as stomatology or dental medicine. So the definition that sort of strikes me, and we have to understand that dentistry is. I'll just tell you a brief about it. Restoration, reconstruction, and rehabilitation of teeth, orofacial hard and soft tissue, and associated structures, with knowledge of working of muscles of mastication, deglutition, and phonation. Okay. Now, when we just think about teeth, we think about root canals, we think about cavities, and then also comes the knowledge of giving anesthesia. Okay. So we have a proper subject, about giving anesthesia, local anesthesia, and then we begin to think, okay, we give blocks, but we are not giving anesthesia just in the teeth. We are giving blocks like infraorbital PSA, which is like far away from teeth. If you like think about what layman thinks or what probably other specialties think. So we have to have a proper understanding and knowledge of maxillofacial area. That's why we keep on getting bugged by this question on facial artery. We have to dissect the facial artery like we focus heavily on head and neck anatomy. Okay. And not just like in 1 year, like in every year. Like every year in dentistry we get these questions. We work also, we study the myofacial musculature. Okay. The question that we normally get is muscles of facial expression. As we all know, we get a 15-mark question. So it's not about questions or anything. I just even read the syllabus, one more time. And you will be surprised, a lot of us will be surprised, that when we study anatomy, there is a practical associated with anatomy where we have to give intramuscular, intravenous, and other injections in live human also. If you go and see in the DCI syllabus, we have to do that as well. Many of us don't know that, and many of us are not made to understand our syllabus at least. Why is the name of specialty, for example, orthodontics, called as dentofacial, like orthodontics and dentofacial orthopedics? Why? There must be some reason to it. Why is it not just oral surgery? Why do we call it oral and maxillofacial surgery? Why do we call oral medicine as oral and maxillofacial medicine and radiology? So when somebody is working in all these aspects, then I begin to wonder that when a general dentist is doing implants and he encounters or she encounters a sinus on the way, he has to deal with the sinus, which in terms of, if we demarcate it with some other specialty, comes for the ENT people, right? Like they are working with the sinus, but we have to put an implant in the bone. So probably orthopedician can get offended as well. Why are you touching bone? So the question is not about cosmetology or aesthetics per se. The question is about the identity of a doctor who's a dentist. Okay.
Wow.
Then probably we should not even prescribe antibiotics. These are systemic drugs. We should not give Hyalase injections or steroid injections for OSMF. OSMF is a condition which predominantly happens in South Asia and India, right? So we are prescribing hyaluronidase, for example, which dissolves the collagen and hyaluronic acid. Now, when we start thinking like this, when we understand our scope of practice, we see that many things which are covered in our syllabus, when we go in the real practice, we encounter a lot of cases where we need to upskill ourselves. So there is a difference between definition of what we do, and there is a difference between scope of practice of a certain branch of medicine, for example. So I would like to say like this. For example, somebody did their PG in radiology 20 years back, and there was no PET scan that time. There was maybe probably not other machines as well, maybe not MRI, for example. I don't know for sure, but I'm just talking about the scope. So these people who did radiology, they learned to see the PET scan, to diagnose from PET scan. They did not go back to do another course, another master's degree. That's the scope of practice. So like in everything, in every branch of everything in the world, we will have advances. Okay. But the scope of practice depends on someone who has knowledge, basic knowledge, to be able to do that. Right now, for example, lasers came in, ablative lasers, non-ablative, for doing biopsies, for example, for doing bleaching. They were not in our syllabus, but I don't have to go to get a degree to practice them. I will upscale myself, and I will start using it instead of a scalpel. I will start using it. So what I like to address is that there is a certain line that some dentists have been crossing. I would say like that. There are certain times when you have disease of skin, dermatology is disease of skin. Okay. When in the name of cosmetology, you call yourself as a trichologist, you give yourself a title. That is like, making people believe that you are a specialist in that. So, I mean, if you ask me, that it is not in my scope of practice to be doing hair transplant, for example. I have no anatomical knowledge. I have no knowledge of anesthesia. Like, for example, it's not my area to work. But if somebody loses maxillary bone, and because of loss of maxillary bone or mandibular bone, which we study to the core, we study the embryology, growth pattern of maxillofacial bones very deeply, because it's associated with function as well. So I have the right to restore it. Okay. It might show some consequences on the skin, but it's actually restoring the bone. So when we talk about fillers, for example, fillers are medical devices. They are not prescription drugs for dermatology.
Right.
And if I have a nasolabial fold, for example, I have lost the bone in canine fossa. I've lost some maxillary bone. I've lost some zygomatic bone. I've lost mandibular bone. Somebody has micrognathia, for example.
Mm-hmm.
So to inject an implant, an injectable implant or a filler, definitely comes in my purview, right? Like, it's not a
Exactly.
skin disease. And I am somebody who's working with anesthesia primarily in this area. Okay. Now, there are many different types of fillers, for example. One is hyaluronic acid. Now, a dentist is using hyaluronidase as a prescription drug. He's using lidocaine as a prescription drug. Now
Right.
hyaluronic comes as a biomaterial, uh, or an injectable implant, for example. So why can I not inject a biomaterial, which I've studied in my dentistry, and I am somebody who's a prescriber for things attached to it, right?
Right.
It's not treating any skin disease. When we are working with myofacial neuromodulation, Neuromodulation, for example, we do neuromodulation like how we do anesthesia.
Right.
Giving LA also is a neuromodulation, right?
Yes.
So when somebody has hypertrophic masseter muscle, temporalis muscle. Temporalis is a muscle which we study very deeply, right? Origin,
Yes.
insertion, all that stuff. So I can neuromodulate it. Okay. So Botox is the word given to neuromodulation. So I feel there is a lot of, it's a lot of it is playing with the words. So I went back and studied also dermatology syllabus. So I was studying their pharmacological, whatever they had in syllabus. And there's a word written there, cosmetic and skin care. Okay. I could not find any other word related to cosmetology per se in therapeutics. Okay. And when I saw the syllabus for dermatosurgery, I might be wrong. I saw the MCI syllabus. So dermatosurgery dealt with, I did not even see hair transplant, to be honest. Okay. So we are not here to discuss all these things, what somebody can do or not do. Whatever falls in my preview, and it's not about prescribing a drug which is used to treat disease of that specialty, then I'm okay. You know, the council needs to address these things in a proper manner. They have to have,
Right.
for example, there are so many countries. For example, I took out the scope of practice of dentistry in UK. Okay, they have a document where they are talking about scope of practice of dentists, dental hygienists, dental technicians. All the people associated with dentistry. And in the last, it was written, in scope of practice, you can learn implants and facial injectables. Now, facial injectables, not for skin diseases, right? Not for skin
Okay.
disease. They've not
Yeah.
mentioned this, but we should not treat skin diseases. We should not use resurfacing lasers. Okay. Why we are talking about this is because a certain specialty objects to these small things, whereas certain specialities they don't even care about. Like ENT people don't come fighting that, okay, you do implant, I will come and do the sinus lifting, you can't touch the sinus. Or the orthopedic people, they don't like complain that why are dentists drilling hole in the bone. Yes.
Right.
So orthopedicians are doctors for bones, right?
Mm. Mm.
And but something, the bones that are falling in my purview, the anatomy that I'm studying. So I feel that many people have crossed line in our profession. Okay. And our council has to address our scope of practice.
Right.
That is important. And it has to be done in a very mature manner, not being regressive.
Mm.
Because if you keep taking away, modalities from our profession, then it's next to nothing.
Mm.
We have to grow also as a specialty. And not everybody has to agree, but
Mm.
there has to be a scientific logic to all these things. But projecting yourself and giving yourself titles is not right. If the MD dermatology, if MCI gives them the title of cosmetologist, they can use cosmetologist. I don't know if they give them or not. Uh, I was reading about it. They write MD dermatology, venerology, or leprology, something. If they give them the title of cosmetologist, it's their title. Okay, we should not use it. If not, then I don't know what is happening.
Mm.
So this is my take on these things. Myofacial neuromodulation. Myofacial is something which I do. I will not let a gummy smile patient. I will not say that gummy smile is a skin disease, for example. Okay,
Mm.
I will not say that nasolabial fold is a disease of skin.
Mm.
There is much more to it than meets the eye. But right now, it's not about that. It's about our fraternity understanding our syllabus and our scope
Right.
of practice. That is very important. Now, tomorrow you can say that, um, dentist cannot put implants in zygomatic arch. We put implants now in zygomatic bone as well, right? In pterygoid bone. So,
Yes.
we can debate on everything. I mean, I'll just give you a quote. कि if somebody wants to help you, they will ask you कि आपके मामा जी का नाम क्या है ना? And if somebody wants to screw you, somebody you don't know, they'll ask कि मेरे मामा जी का नाम क्या
Right.
है?
Exactly.
So that's what I think. We should not cross the line. We should not treat skin diseases. We should not take the titles.
Mm,
As a BDS, if your scope of practice says that
mm,
you can put implants, you can do sinus lifting, you can do, okay, one more thing. For example, now there is a filler which is called as an injectable implant, hydroxyapatite.
mm.
We are already using hydroxyapatite for sinus lifting. It's already like a device. It's categorized under medical device. We are already
Yes.
putting it in sinus. We are already putting it once we remove cysts, or once
Mm,
we remove impactions. We are doing bone
yeah.
grafting, right? Bone grafting. What is that? Hydroxyapatite. So it would be very strange that to say, okay, listen, you can open up the bone, you can open up the sinus, do whatever you want, you can open up the maxilla, but don't inject there. Don't do non-surgical work. Just do surgery.
Right.
So there are a lot of biomaterials.
Mm,
You cannot say that hydroxyapatite is not biomaterial for dentists. That would be like, that's the foundation of our bone is hydroxyapatite. Teeth are hydroxyapatite, right? Yet most
exactly.
most we can do is we can start doing intraoral fillers. That would be a very novel way. I do that.
Mm,
Then what? So doing fillers is like restoring zygomatico maxillomandibular restoration. Okay, these are much deeper things. They need much deeper knowledge. I wonder if dermatologists know how to give blocks, um, intraorbital, inferior. You have to have a proper knowledge about that.
yes.
Yes. So you have any questions? Do tell me.
Yes, yes. So I have very basic questions like the tribe that has been following me is it varies from budding dentist to practicing dentist as well. So not many
Hmm.
dentists, they are really confused. Like if you could let them know ki what exactly is in a very simple and crisp way, Botox fillers, threads, and trichology and cosmetology, and where
See.
all we can draw a line as a dentist. You have already narrated very well about all this, but in a crisp way.
Mhm. So trichology, I don't think that a general dentist should do at all. Okay.
Yes.
Oral surgeons, they might do it because they are raising flaps and all, so they have more knowledge about it.
Right.
But injectables for facial restoration, maxillofacial restoration, is something which is a part and parcel of what we are doing already. Like, for example, even if you do or not do implants, you are supposed to do implants. You're supposed to have a surgical, and this is in the domain of general dentist. Okay,
Right.
so you are giving incisions, you are opening the flaps, and so injectables is something very simple, similar. Injectable fillers are like implants and or prescription drugs, for example. So depending on what we are, catering, and you are already like halfway there because you know how to give anesthesia in this region. Botox is a neuromodulator. So, it's see how it happens is that Botox is a company name actually, and we speak just Botox. We write Botox. It's not like that. We are working with neuromodulators, and botulinum toxin is one drug which is a neuromodulator. And there are a lot of indications in which Botox will help us for restoring the teeth and the facial structure. Hypertrophic maxilla, dystonias, for clenching or grinding teeth at night, for example, bruxism is a sort of dystonia. So Botox helps a lot with that. It also helps with bone training when we do implants. So when we place implants and we have to place a load on the implant, before that we inject Botox in the muscles of mastication, okay, which are a little bit hyperactive. And this helps our implants to adjust to the forces very well. Okay. Then we have things like gummy smile, which is aesthetic as well as pathological condition. Why? Because if I have a gummy smile, my gingiva stay dry. Okay, I get pigmentation in gingiva. So these things, threads also are injectables. Okay, we are working in maxillary area, mandibular area. So we first have to define what is a skin disease and what a skin disease is not. Like what is a skin disease, what is pertaining to skin, and what is pertaining to bone.
Right.
So if you see the changes that happen, if we study we study a lot of these changes when we study prosthodontics, because we see the age changes that happen, and when we lose teeth, we lose bone as well. We also
Right.
lose bone when we are aging. So restoring that bone is also part and parcel of restoring a proper function.
Right.
So, restoring mandible, or somebody having a smaller chin, micrognathia, retrognathic chin. And if somebody doesn't want to go for a surgery, they can have an injectable implant to have a proper proportioning, right? Now, I'll put a question to the audience. I get a case of lip mucocele, okay? So, I normally use lasers to remove it, okay? So, I'll remove it with laser. And later, when I have to restore that lip,
Mm.
am I not the person who will inject filler in the lip, right or not?
Exactly.
It can never be, you can never ask a surgeon who gives incision, for example, in the stomach, that, okay, listen, you give incision, you do the surgery,
Mm.
but you will not inject there. If you have an injection to fix the problem,
Mm.
that you can't do.
Exactly.
Okay.
Right.
So, and I have been telling this for many, many years now. And I
Mm.
have been amazed at how dentists have been breaching the line and working as skin doctors. Trust me.
Mm.
I would like, in my opinion, in my knowledge of scope of practice, or whatever I've seen in countries who define scope of practice in a proper documented manner,
Mm.
don't you feel strange that why are these things not addressed properly? What
Seriously.
stops them to write about it in a proper manner? Why don't you
Mm.
define? And why don't these, the scope of practice, changed every like a couple of years or something? Because so much is coming up. If I don't use fillers for facial restoration, I keep on waiting for letters to come that we can do it. Then, when will I, improve myself, or when will I? When implants came, there was a lot of debate on implants. Oral surgeons wanted to do it. But, it was, it's always been like this. It's always been confusion. It's always, you know this, right? Like,
Yes.
implantology has had its game. Like, initially, it was an objection to it also, like a general practitioner cannot do it. Why not our councils be proactive and, see these changes themselves,
Mm.
right?
Mm.
Yesterday I was, I'm in Sweden right now, and we were having this discussion about this war in Ukraine, and there are a lot of refugees here. And I was wondering that the kids who came back from Ukraine, who were studying their MBBS there, why do they have to now struggle for their education? Why is the government not taking action?
Mm.
I mean, sorry, I'm just stepping to the other
No.
side, but why does it happen like this?
Mm.
Why are we running here and there? See,
Mm.
a case comes to me who
Mm.
needs Botox in masseter. Like, I don't, like, it's my job. If I don't, fix this problem, then it's a job not done by me. You
Exactly.
understand?
Yes.
If I have a gummy smile case and that person has, has dry mouth, a lot of important friendly bacteria are not there to fight infection, for example. Okay.
Mm.
Is it not me who's not giving an option to my patient and preventing a good job being done? Also,
Right.
if somebody has pain in the joint, TMJ, and
Mm.
I can see that person is a bruxer, am I not supposed to give them all, and they don't want to probably go for surgery, for example?
Mm.
Is it not a job not being done by me? Am I not liable to not, tell that person? So, things have to, why is there so much confusion? I don't understand. And secondly, why are we putting titles which are not given to us?
Right.
I'm, for example, I'm a dentist or I'm a radiologist. Okay, I'm a dentist. Whatever falls
Mm.
in my scope of practice, I will do it. 10 years back, people had so much objection on implants. Now it's
Mm.
mainstream. And the point is to understand and respect each other's scope of practice. I mean, I
Right.
cannot just sit here and decide scope of practice of other specialities, right?
Exactly.
On the other hand, I cannot call myself a trichologist. Am I right or not?
Right.
Is
Absolutely.
it not
Yes.
unfair to call yourself as trichologist, to call yourself as a skin care? Why? Skin
Mm.
clinic?
Mm.
Why are you, how can you do it?
Mm.
The real thing you are not doing.
Mm.
The real thing are injectables meant for
Mm.
restoring facial
Mm.
restoration, working on the changes that have happened because of the bone you study your whole life, the bones you
Mm.
study your whole life, the bones in which your teeth are attached,
Mm.
right? So
So,
injectables are, we use injectables when a patient comes to us and requires those treatments in our chair, the areas we work in. This subject that we study, orthodontics. It's orthodontics and dentofacial orthopedics. Dentofacial orthopedics, right? Oral and maxillofacial. Why are these facial words there? And when I am doing orthodontics, for example, am I not also fixing the aesthetics, the proportion? Who understands facial proportion better? Somebody who's studied cephalometrics, who understands cephalometrics or not? And is and if someone is doing aesthetics on the face and they don't know cephalometrics or or the relation, is it not wrong on their part to be not knowing how to give blocks, to be not knowing the relation of hard and soft tissue of the face with each other, right or not?
right. Exactly.
So intrinsically we know this. Intrinsically we know this. So it goes both ways. You know, we have to understanding our scope is very, and facial, like I would like to call what we should do is myofascial neuromodulation and zygomatico maxillomandibular restoration. Okay? And of
Yes.
course, nobody can stop us from doing that. No one.
So, you very beautifully demarcated, about the scope part, like what comes under the scope of a dentist, and also the
Yes.
legal part. That itself explains that where all do we need that legal aspect, where all do we need to get scared
No,
about
and
the legal.
also one more thing, that it's not me who's saying this.
Mm.
There are a lot of countries regulations that say this.
Mm.
If how where does the Indian dental education lack that other countries they don't lack, that they allow them in their scope of practice? This is what I'm asking, to be honest. Where
Yes.
did where were you lacking in teaching me
Mm.
that you are not able to put it on paper,
Mm.
that
Mm.
dentist
Mm.
has a scope of,
Exactly.
right or not?
Yes.
How come
Absolutely.
dentists from other countries who are studying same as we are,
Mm,
same education,
mm,
writing this? I don't. I am just saying what I read, and I look at all the regulations from other countries. This is what I'm asking. I'm asking whether there is a question mark on dentist being a doctor also.
mm.
Then,
Well,
then we
Ethan.
should probably modify our education as well. Sit down with teeth, start
Mm,
with teeth, and finish with teeth. Why so much facial artery dissection in anatomy? Why IV injections? Why all this? Why so many questions of muscles of mastication? Every year you get question, right? Like
yes,
dissecting them, you know. So,
yes.
I feel it's a confusion, a lot of
Mm,
misunderstanding between different specialities, and that needs to be addressed. There has to be, because then people will tell patients, oh, we are afraid of ENT doctors. They will complain. We should not do sinus lift.
mm, mm,
We should. I will not touch your bone.
mm,
He's
mm.
from orthopedic guy. He will do it. So there's a lot to it. There's a lot of science to it than speculation.
Right. So,
Yes.
I'll have one question, and then I'll leave it to audience if anybody would want to share the screen for a minute and ask a question, or viewers watching us can raise your questions. Meantime,
We can
not
also we can even like you can type in, or I can type in my number. We can have a WhatsApp like later on if somebody wants to, you know.
would be excellent. That would be an excellent
Yeah,
idea.
that would be much better. Yes.
Yes, would be much better. So what we'll do, we'll try to make a group and we'll add in
Mm-hmm.
people having questions or
Yes,
concerns. And
definitely
maybe
that would
after
be
a
good.
week
Yes.
or whenever you're free, we'll take all these
Yes. Yes.
questions. We'll type in and you
Mm-hmm.
can drop in your replies in voice messages. That would be a bit convenient on
Very
your
much
behalf.
better. Yes. Yes.
Yeah,
Yes.
yeah.
Yes.
So
Mm-hmm.
one more questions. Like there are n number of budding dentists looking for courses, So
Mm-hmm.
courses, hands-on workshops. What is your criteria? Like what do you suggest that what should be the criteria of selecting a course or a mentor for doing this?
See, first of all, I want to tell you one thing, very important thing. A BDS or any graduate in medicine, they are entitled to practice whatever is there in their syllabus, right?
Right, right,
Now, I find it very strange that people seek a degree or a certificate or see, in India or anywhere in the world, a title is given by your council. So
right,
if you enhance your skills somewhere, you
right.
don't get a title.
Exactly.
So, okay, for example, if I didn't like before I learned lasers for surgeries, and I have a hard tissue laser, soft tissue laser, both. I took a training, to learn, like to work with incisions, to give like whatever indication. Now, that doesn't give me a title. It's a part of my, scope of practice. A lot of there, this also is a very important aspect, because people think, oh, we got this certificate. Now we are, no certificate is valid.
Right,
It's
right.
your,
Exactly.
like, no certificate is a degree, is a
Mm.
diploma, for example. Okay. And
Yes.
it is, see, there are different, I will explain you another thing. We'll go back a little bit.
Mm,
Medical science or dental science, whatever, surgery, whatever, is learned from a person to another person. It's like that, you learn, and it's
yes.
not like other knowledge. You don't just sit there, learn from the books and do it. So there is a process to it. You in your education where you're studying, for example, in your college, dental college, for example, you go there. There is a certain way. You look at your seniors, or your or the PGs there, or your teachers will show you. There's a process. You will look, then there are certain number of cases you will do, right? And then when you pass out, there are certain things which you want to learn. So you will go to probably some hospital, you'll take a job, or you will go to someone who is already doing it, watch them and help and teach you. Like, this teaching has always been there. This teaching, it's because of this teaching, the medical fraternity is what it is. It's always teaching going on. Always.
Right.
We all learn through that. Like our profession is such. If I'm not so confident in posterior root canals, I'll probably, if I'm in the college, if I'm doing internship, I will learn it in internship. If not, then I'll maybe join some college and study there, like, and teach there and learn, or I'll go to some clinic and learn. That's how it is. Don't make it sound like a certificate course, like it is, yes, there are certain fellowship programs, but it's not a title. You can't put it as, or you can't say, I have this degree. No, you have this skill, which you learned, which we have been learning from like everywhere. I remember when I had to learn implants, I requested some senior implantologist. I would go with him for his cases, assist him. It's always been there like this. Don't, and this is what the problem is that has happened. People, getting, trying to, make it look like a title. It's a skill that you've learned in the something that so you have basics, and you learn a skill from someone. Nobody
Right.
has been born with this skill, and nobody will be born with this skill. No syllabus, no college will be able to teach you everything. New things will
Right.
come, and it is your choice that you want to be upgrading yourself or not. Probably some, for example, lasers, hard tissue lasers couldn't make it so big because they were expensive. Probably, and there are certain countries like Taiwan where they are doing cavity cutting with lasers only, right? They learned it in their college with the bar, right? But they don't need to put a title to it,
Exactly.
that you need a new title or a new certificate. Yes, you learn this skill, and to make it nice, you put somebody's name who has a big name, that you learned from, you assisted that guy, or you learned from that guy. These titles that are coming in now, cosmetologist, trichologist, why? जो आपकी ब्रांच के आपके पेशेंट आया है और आपकी स्कोप में है, आप उसका सब कुछ करो, उसका मैसेटर को रिलैक्स करो यार, यू नो इतनी
So
मतलब,
I,
that's not, putting up titles is not right, because there is only one title, that is the title given by your council. Rest are your sort of experience papers. There are certain organizations, or when you do a certain number of cases, they give you some fellowship program, but that's not a title per se,
right.
or a
Right.
certificate. What certificate you need? You can't claim that I have this certificate and I'm doing this. You have your degree. It's enough.
Like
Do you find a radiologist put a certificate in PET scan? A new procedure comes in. So this mindset has to go, and we have to act very maturely now. Like, all this, what happens is that because of social media, it's sounding very immature. The Indian, like, our mindset is sounding very immature, because in many countries, dental hygienists are doing fillers, you know, nurses are, and they are shocked what's happening, because obviously there is an overlap now, like everybody can, you know like, things go, so it sounds very amateur. You learn a skill and you do it, you know you understand my point? This is
exactly.
very important. You are not entitled to a title. You are not entitled. It's a skill that you have, and you are working in the area where you have learned everything, like anesthesia giving. If somebody, like another, for example, an MD medicine decides to Botox, yes, they can do it. Like, they will not put a degree to it or something. They will maybe use it for headaches, but they will have to, if they decide to do fillers, they will also have to learn to give anesthesia in the oral, like for the maxillofacial region. Somebody has, like, if you want to do something, you have to learn it. And this is how the things are. Okay. So BDS doing hair transplant, like, it doesn't sound right, doesn't even the discussion that we've done. So, and then what happens is that a common term is picked up, an umbrella term is picked up, and everything is put under that, like careful selection of words,
mm,
Like, what is cosmetics? What is cosmetology? Now, makeup is also cosmetology, right?
right, right, right.
Cutting hair is also cosmetology, like cosmetic aesthetics, right?
Yes,
And
yes.
hair is with certain branch, for example. But
Mm,
there are prescription drugs, then there are OTC. People buy sunscreens, for example. People buy cream. I can buy a sunscreen.
mm,
It can like I will not get a letter that you are buying sunscreen. It has to be prescribed, for example. So it's a very, very big umbrella. What you call
mm,
is cosmetology. What is aesthetics?
mm.
What is functional restoration? So there is not a clear demarcation, and it has to be very, very clear and point on. It has to be like written.
Mm,
But if you ask me, I told you like what all um, like our scope of practice. Like you can't ask me not to inject hydroxyapatite, right? Like I'm already doing it.
mm,
I'm already putting it in sinus, for example. You know. Now, just a very simple thing now. If you do PRP extraorally,
mm.
I can also do it intraorally. It reaches the same place. Yes. I can also give
Yes,
infraorbital block from outside. I can also give it from inside. So if you see it scientifically, how funny it sounds.
exactly.
Also funny it sounds that a dentist writing trichologist. Very funny, you know. And
Mm,
trust me, I have been very concerned for many years.
mm,
Like hardcore skin practice by a dentist.
mm,
It's very scary, trust me. Work in your domain, okay? Restores the bone and it will give aesthetics as a secondary effect. Yes. Why
beautifully
why do
made.
we have these lines? Why we are restoring what has been lost? Yes. So, when you have to, so you were talking about learning.
Mm,
The point is that learning happens. So we'll give an example. I'll just give you an example. So I have to learn something from you, like you're doing
yes,
implants. So I will come to you, for example. Okay, I like your work. And one is that you will help me assist you. I will
mm,
see, and you will say, okay, you can see it for like 1 month, and then you can go back and do it. There is one way of doing it. Other way would be that you will say, okay, Dr. Rajat, let's do like this. Um, I'll make you assist for like a couple of days, and then I'll make you place implants under my guidance. No problem.
mm,
So if I place, for example, 10 implants with you, then I can go back and then I'll have your guidance as well. Dear, ये शुरू से ही हो रहा है ऐसे.
mm,
अब everything, nowadays everything has a fancy term to it. But no learning can happen without a mentor. Even if you are in college. I mean, I'm grateful to so many of my teachers
mm,
who used to scold me, and I jokingly say this, that we used to hate them, but what they taught us, like
mm,
somebody, like many people have to teach us in college, and then somebody has to teach us something. This teaching, it's irreplaceable. We work with hands. We are not working online on patients.
mm,
Okay. So to learn something, you have to have a mentor who is already confident enough, who's done enough work, and who says, okay, now your turn, come and put it. I'm standing here. If need be, I will hold your hand. The
mm,
patient has to be told about that.
mm,
Okay.
mm,
The patient knows about it.
mm,
ऐसे ही होता है. Now, nobody goes inside an OT to see who is doing hair transplant.
mm, mm,
Technicians are doing many times,
mm,
right? So students are doing.
mm.
I mean, I can say I do it, but inside OT,
No,
right or not?
absolutely.
Yes. So every and in hospitals there are junior doctors, senior doctors. So senior doctors, they will assist. Senior doctors will give them a chance. Okay, this case is yours, we are here, we will assist you, or you partially help, or you do this, or you do like this, like that. So this is how the learning will take place. It will it I will give you an example of injectables in terms of implants. The more number of implants I do, the more confident I get. I already have knowledge of giving anesthesia. I already have knowledge of doing extractions, for example. I already have little bit knowledge of the flaps. And then I enhance my skill. I learn about implants. I learn about sizes. And when I actually put the implants with my hands, I will develop a hand and brain connection, the feeling, the consistency, everything. That is the best learning. That is the best teaching also. I cannot just show you my cases and you can learn. No, it looks very easy. When I see a video of an injector, what I observe and what you will observe is completely different. I will see how they are standing, what is their standing position, how they are using their other hand. They are doing crow feet. Is their needle away or towards the eye? Okay, so many damn things. What is the angle of entry point? You can look at my videos. I'm just going in tuk 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 tuk, right? It's not tuk 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 easily. There are so many damn things. Your position, your way of holding, the syringe, the cannula. How are you holding it? Like this, like this, like what? Like how do you enter? How do you maneuver? This can only be learned through proper working on the patients. And there is a lot to it. Like when I look at videos online, there are certain times I really laugh, like but nobody knows, like even they don't know, and they are putting up that video, like doing it not the ideal or right way. So there is much more to it than meets the eye.
So, very beautifully narrated. I think viewers are already requesting to save this session. Just to let you know, all
Perfect.
the viewers, yes, we will for sure save this. Also, we'll upload it on YouTube. And Dr. Rajat is always there with us to answer anything. You'll have to be like you'll have to send your question in advance. That would be apt and proper. And Doc, is there anything wrong with the marketing part? Like, how do we dentists who have learned this art is projecting it in a wrong way? Do you think is this uh, the
No, I
problem?
this is what I was telling you, that putting wrong titles, like putting titles is a wrong thing, which
Mm, mm,
it did. If you like, if you the titles are not right. If I don't know about if they have a title of cosmetologist or not, but
mm,
if they don't have it, then wrong on their part also. Like
mm,
if you have, your degree has to be mentioned,
mm, mm,
and whatever treatments that you do have to be mentioned.
mm.
Okay, you
Right,
can't call yourself as trichologist. Like that is wrong. It's not a title.
right.
Yes, but I feel that uh, it's really important for the council or for bodies which are decision-making bodies to have more clarity, on these things.
Exactly.
We definitely need it, and we definitely also need it when for example, somebody joins a dental
Mm,
school, dental
mm,
college. There should be like few days sessions, orientation sessions, where,
mm,
like, every time I go back and read BDS syllabus, I find something new.
mm.
Till now, such
Okay.
vast is the syllabus. Like every time, whenever something happens, I go back and I look what all,
Mm,
and it amazes me that what all is there in our syllabus. How, like, how are the names given to our subjects?
mm,
It could have been orthodontics only, right? Why
mm,
have they given dentofacial? Like, why not only oral surgery? Why oral and maxillofacial surgery, for example? Okay, so we have, like, and there should be someone who can explain it to them in a proper manner, then explain them the scope of practice when they finish their internship. That, listen,
mm,
have an orientation. This is what you've done.
mm,
These things are also there,
mm,
like so. For example, I don't want to practice implants, so I will not learn it and not put in my scope of practice.
Right.
Somebody wants to have their scope of practice expanded to as much as they want, that's their choice. Now, for example, you do veneers, probably not so much in college. So if I want to do it, I will, I will go to some college or
Mm,
some private doctor or some hospital
mm,
and work and learn from them, right?
mm, mm,
Someone who's doing a good job.
mm,
That's how education is. Like, you also cannot stop people from learning.
mm.
Where would you learn from videos? You can't even, like, you can see a video but you can't even in depth analyze the video if you don't know something.
Right.
you know so many things are there. So so when we talk about, like, when we talk about courses, or like, it's always been there.
Mm,
Learning has always been there from one human being to another human being in our profession and any other profession. Yes, of course, there are certain professions where you need to have more theoretical knowledge and you can implement it practically without, you know, working on something or someone. But here we have to learn on a living person.
mm,
Okay, and learning has to go on. I have to teach you. You have to teach me. More senior people have to teach. Like, it has, and they will also be learning.
mm,
Someone learns a certain modality, you can learn from them. That's a free will.
mm,
But putting titles to it and using it as titles is a wrong thing. Making it feel like a degree, making it feel like a, that's not the
mm.
right thing. You learn a skill and you do it. It's in your scope of practice. This is what I insist on. Your patients are going to take your exams. Real
Mm,
exams are in your clinic, in your practice.
mm,
Okay?
mm,
You cannot show, oh, look, I'm this, and not do a good job.
mm,
It's not this certificate, it's your job. They will
mm,
come back for your job. They need results.
mm.
Nobody will say, okay, oh, give me your photostat at 10 copies. Wow, my face looks amazing. My teeth look amazing now, because you have to work. So what I feel is that a lot of kids, or, just they try to, show titles, and that's not right.
I think people they need to watch Three Idiots again, not to run behind titles. All
No,
right, Doc.
we must
And
use the rightful titles.
yeah, the one we deserve.
Yes, the one that we are given, and then in our scope of practice, cover the things that we have to do.
I think there lies a lot many questions that has been answered, and
Hmm.
as we know the demarcation, what to do and what not to do. Like we will have to
Absolutely.
understand what not to do. What not to do is the main punch thing which we need to focus.
Absolutely. Where to not cross the line.
Yes, and once
Hmm.
we know, we will not have to worry about the legal aspects. About the
Absolutely.
legal.
Yes.
Once you
Yes,
know
absolutely.
you've been under a right mentor, you're choosing cases correctly, not crossing your lines,
Hmm.
and
Hmm.
doing the job and not focusing or projecting yourself as somebody XYZ you're not entitled to.
Absolutely.
And then everything will
You
fall
summed
into
it up
place.
very well.
Yes. Like I'm listening very attentively.
Okay.
And your session, trust me. I mean, lot many comments. We can see lot many comments, and people are really expressing their gratitudes towards this session. Words would be short to express our gratitude. I think I've been listening on these topics, n number of speakers, n number of people, but the way you've projected things is so 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 beautiful, and so clear that we are really thankful.
Thank you so much for having me over also. And
Yes,
good that
yes.
it worked out for this Sunday also. Good, I was
Amazing.
able to.
Amazing. I would really appreciate, guys, the followers watching us and the people watching us, recorded. Dr. Rajat was so prompt and he was so nice. Like I texted him around a day ago, and although he's in Sweden, he didn't deny it, and he said, "Yes, Ravi, I'll be there." And so we are thankful to you for your precious time on a Sunday, you know. So one last question, Doc, before you leave.
Y- Yes, yes.
Is there any council or a body or something like this, which for practitioners? As we know,
No,
DCI is not like, I don't know whether DCI is backing up things which are under the scope of dentist, but
no, DCI
beyond
had
the
recently DCI had I saw a letter from DCI where they mentioned that certain facial surgical procedures are under the domain of oral surgery, they had mentioned, but they had only spoken about the surgical part.
the
So
trichology part. I read an article only about trichology part.
no, no, no.
That a surgeon.
There was an article which there was a letter which was issued that the facial cosmetic surgeries falls under the oral. It's in the curriculum. It falls under oral surgery preview, but it had written facial cosmetic surgery. So they had not mentioned the non-surgical part. That is the
Okay.
injectable parts.
Okay.
So the good thing is that the council has accepted it,
Hmm.
at least the surgical part. But it would be strange to not have the non-surgical part also then, like I said. Okay. So, yes. All right then. We'll cut it close now.
Yes.
Uh,
Yes.
and we'll
Thank
be
you
in
so
touch.
very much. Yes, we'll be in touch, and thank you so very much for your time. It means a lot to me as well as to all the viewers watching this. Have a great Sunday ahead.
Thank you
Thank
so
you.
much. Thank you. Thank you. Bye bye. Bye.